everyone, my name is Samantha Harte and I'm a doctor of physical therapy. One of my favorite things to do is bust myths about the body. Myth buster number 3 is if I strengthen my quads and my hamstrings, my knee pain will go away. This has some relevance if your quadriceps and hamstrings are actually weak and are the source of your knee pain. Making them stronger might help your knee pain go away. However, it's only one piece of the puzzle. A really important factor that a lot of people don't know anything about is looking above and below the knee, because the kinetic chain is attached. So whatever you do at the hip is going to affect the knee. Whatever you do at the foot and ankle is also going to affect up the chain into the knee. And there's been a ton of research that supported turning on the hip muscles in particular and how that stabilizes the knee joint. So if you take a look at some of the muscles on the side and back of your butt, the gluteus medius is on the side, the gluteus maximus is on the back. When you learn how to activate those muscles, wake them up, and then you get them stronger and you move them dynamically, they actually support the femur bone, which is where the knee joint actually is. So the stronger your butt muscles are, the more stable your knee joint becomes. So maybe think a little less about your quads and hamstrings, which are often pretty strong on people. Think a little more about your tush. Hi everyone, I'm Samantha Harte and I'm here to show you really quick ways that you can turn on your gluteus maximus and your gluteus medius to help control knee pain. So if you're just standing, you want to relax and take the locking position out of your knees. And then you want to give your tush a real squeeze, and you can watch and see how it actually turns the thigh bone straight ahead, which means that the knee joint is now directly under your hip and directly over the ankle instead of being inward, which is more dangerous. The other thing on one leg that a lot of us tend to do is actually dump our weight down into the hip joint, which means our pelvis collapsed. So whenever you can, even if you have both feet on the ground, but especially when you have one, if you can lift your body up out of the hip, you'll basically turn on the gluteus medius, so the outer hip of the leg you're standing on, which again helps line up the thigh bone so the knee joint is in an optimal position for load bearing. Hi everyone, my name is Samantha Harte. I'm the owner of Strong Heart Fitness and a doctor of physical therapy here in Santa Monica, California. We are on the mat to do the first 3 exercises of a stabilization program that will help turn on the muscles around your hip and pelvis to bust myth number 3, which is that stronger quads and hamstrings will help control your knee pain. So these exercises are going to wake up some muscles that are big stabilizers all the way down the chain into the knee joint. You're going to get to a 60-second hold before we progress to something more dynamic up on your feet.
First exercise in the knee pain sequence is a sideline clam. So you get onto the mat, bending the knees and tipping the pelvis slightly forward, pulling the belly in and spreading the upper hip out and up towards the sky, keeping the feet together, trying to get that top tush muscle to turn on and support you. To see it from the front, when you flex your hips, you want to back off just a little bit. Watch out for rotating through the spine, so push the pelvis forward, draw the belly in, feel with your fingertips that your abs are tight, and rotate the top hip up and hold, feeling it in the top glute as long as you can, up to 1 minute. For the second exercise, you reset your abs, extend the top leg, move it back and up, and hold, feeling it in the side and back of that top tush muscle. Let's get another look at that. From the back, we extend the leg, move it back, and watch out for that rotation in the spine. Straighten the leg up, checking to see that you feel the side and back of the top glute muscle, and hold. The final exercise is on hands and knees, so you stack the joints, you engage the chin tuck, spread the shoulder blades, pull the abs in, take the leg you're working back behind you, keep the knee bent, and swing it out and up like a dog peeing on a fire hydrant. Watch out for sinking, press back up and hold and hold and hold. To see the other side, stack the joints, engage the neck, shoulder blades, abs, extend the leg, and swing out and up. You want to feel that cheek of the leg that's up in the air. Watch out for the spine rotating. And hold. Remember that you want to hold for 1 minute before we move on to something more dynamic.